Welcome everybody. For our topic today is talking to the experts about ADHD, nutrition, and supplementation. And we have a doctor, or two doctors, sorry, a geneticist, and me, who's a parent too. You might recognize me. My name is Kimberly. I run the social media page for NeuroNeeds, and I'm also a parent to a child who has ADHD. And if everybody would like to introduce themselves, we can get going.
I'm Dr. Richard Boles. I'm a pediatrician. I'm also a geneticist. I was at Children's Hospital Los Angeles for 20 years. I did research, mostly saw patients. I have been in biotech. I'm working for DNA sequencing companies as their clinical person. I also am in private practice and work for Neurobilities, which is based in New Jersey, but it's really on Zoom and the internet, seeing patients with neurodevelopmental disorders, autism, ADHD, and others, and doing DNA sequencing. And then I'm also coming to you. I am a founder and the medical and scientific officer for NeuroNeeds, a company that makes supplements for people with neurodevelopmental and other issues.
All right, and I am Dr. Audrey Griesbach. I'm a developmental and behavioral pediatrician. I've been in private practice for 43 years. And although I call myself a pediatrician, I have seen many patients who have, over the years, who have stayed with me. So I now have 20-year-olds, 30-year-olds, 40-year-olds, and even a 50-year-old. So I'm now getting lots of experience with the older age groups with these various disabilities. I treat ADHD, learning disabilities, autism, genetic disorders, cerebral palsy. I treat the wide range of developmental disabilities. I'm also a wife of a husband with dyslexia and ADHD, and my oldest son had severe dyslexia and some ADHD as well.
I forgot to mention that my son has ADHD. I can't forget, and Dr. Griesbach is his doctor.
My name is Erin Falco. I'm a registered dietitian. I also practice integrative and functional medicine in the nutrition space. I started out by practicing gastrointestinal disease and working with patients with eating disorders. And then I transitioned my practice to working with physician under medical scope, and then started working with more naturopathic doctors and other providers in terms of acupuncturists and chiropractors. And then I started a private practice. I have other dietitians that work with me as well. And now I'm focusing more on ADHD, PANS and PANDAS. My son actually was diagnosed with PANS and PANDAS, and that's what made me switch to integrative and functional medicine about 5 years ago. So I am seeing a lot more kiddos, pediatrics now, whereas before I was seeing more adults. And it's been a really nice transition to be able to help parents navigate those challenges that are coming up with behavioral, and also just finding other solutions and alternative approaches besides just medications. And so here I am. Thank you for having me.
All right. Thank you, everybody, for being here. Okay, so our first discussion topic is, what really is ADHD and how serious is it?
I'll let Dr. Griesbach.
Okay. Well, ADHD is a very significant disorder. I prefer to think of it as a difference in how the brain works rather than as a true disability. Although from a school perspective, we call it a disability. You know, the DSM has all the different criteria for ADHD, but these are, the criteria are all external manifestations of the neurologic problem that's going on in the brain. And really it's a neurologic problem in that prefrontal cortex. To me, the prefrontal cortex is a lot like the the motherboard of our computer, and it connects with all the software on your computer. And if your computer is glitchy, then you can't use all that good software. And so for what's happening with the individuals with ADHD is that prefrontal cortex is not processing well, and it is the connector to the other parts of the brain, the thinking parts of the brain, the learning parts of the brain. So information doesn't get in, information can't get pulled out efficiently. It's frustrating for the individual, we often wind up with secondary behaviors because the child is frustrated, or they may get anxious, or they may get withdrawn, and they can't learn as well. And it's important to really address this problem, just as you would giving your child glasses. You wouldn't just have your child sit up closer to the board in the classroom. You would make sure that they're wearing the right prescription for their glasses so that they can see well and they can learn well. With ADHD, we need to do a variety of things to help their brain process more efficiently. Medication is a real key factor for treatment of ADHD. And when it's done well, it can make a huge difference for children. They go from a child who is failing in school, frustrated in school, teachers are frustrated with them, to someone who is capable of learning and can feel confident and good about themselves. In addition to the medication, though, children need sleep. One of the problems that we have these days with all the electronics and our more fragmented lifestyles is that kids are not getting the number of hours of sleep that their brains desperately need. So they're getting 7 hours of sleep instead of 8, 9, or 10 hours of sleep, which can impact how their brain is functioning. So when I'm working with a family, sleep is something that is very important for us to address. Exercise, again, kids are sitting with their screens and they're busy either on their social media or they're busy doing some video games, and they're not getting out and moving their bodies. And we know across the board that our brain and our body does much better when we have exercise and physical activity. And then I look at the nutrition component. A lot of times kids are eating a standard American diet, which is not helpful for them. They're eating a lot of processed foods, a lot of carbohydrates, and not enough protein. They're not getting enough nutrients from vegetables and fruits. And so we, look at the diet and try to adjust that based on what the child will eat. And then in addition, I also look to support their nutrition through a variety of supplements. In this case, a lot of times it's either spectrum needs or energy needs or focus needs. And I use the other supplements like the omegas. A lot of my patients also have other disorders. They may have ADHD, but they may also have autism, or they may have a mitochondrial disorder, or they may have other more poorly defined behavioral disorders. And so I will incorporate all of these. I will incorporate all of these strategies with those patients, and might use other supplements such as NeuroNeeds also.
You look at this with the computer metaphor, and I look at this sort of like with the presidential or the CEO metaphor, and that you have an executive. It could be a CEO of a corporation, or it can be president of a country. and has to make decisions, and that person's decision is the law. That's what's going to happen. And it has a whole bunch of advisors, and the advisors are all from different areas, different walks of life, and some of them are like really positive and some of them are really negative. And they're telling the president what to do, and the president has to make a decision. If there's nobody sitting behind the desk making the decision, then nothing gets done. And you're right, all of these advisors can be really smart and they could be really on top of things, but nobody's making a decision, so nothing gets done. And I look at it and said some of those advisors are like telling you to do bad things, and other advisors are telling you, no, you should be doing good things. But the person at the desk is not listening to anything. And so when a decision is absolutely necessary, it's usually it's often impulsive, because they're not listening to any of these voices, and so it just goes ahead and does something, or doesn't listen to as many voices.
Yeah, and the reason I like I like your analogy, and in the past I used to use something like that, but I like the computer processor analogy a little bit better, because what happens if you have a computer that's old and slow and glitchy, then you can't access the software, and you can't download information. And the same thing happens with kids or individuals with ADHD, is that the processor is not going at the right speed. Very often teachers will say, if he just slowed down, he could do better, because the brain's really going at the wrong speed. So I think that I like the processor analogy a little bit better. And a lot of my patients can be extremely motivated and want to do well. Their CEO is sitting there saying, okay, you got to do this, you got to do this, you got to do this. But in point of fact, there's that processor isn't working well, and so the CEO is just stuck in the mud and can't get anything done. And so sometimes medications like the ADHD traditional stimulant medications help. Sometimes for some of my patients, actually medications like Wellbutrin, which is an antidepressant, but it's a selective dopamine and norepinephrine reuptake inhibitor, and that can suddenly turn on that motivation. You can make them want to do those things, even where they were stuck in the mud and couldn't get it done.
I find that interesting because before my son was diagnosed, one of his big issues was reading comprehension. He could sit and read a story and read it out loud and read it beautifully. And he could literally read it to me, and then I'd ask him questions about what he had just read, and it was like he hadn't read it at all. To write it, he was also having to write about what he read, and he would just get so frustrated and, usually end up in tears because, he wasn't understanding what he was reading. And then once he got diagnosed and he got on the correct medication, it was just like, he's like, I can understand what I'm reading. And he's a sophomore now, and he actually just came home the other day and he got an A on one of his papers that he wrote. So it's amazing what, the right diagnosis and the right treatment, can do for their brains.
Yeah,
what I'm hearing you guys all say, I'm sorry. What I was hearing all of you say is that the executive functioning of the brain isn't able to work, essentially. And so when I think of that from the nutrition standpoint, in terms of our blood, we have about 1 liter of blood that enters our brain every minute, right? So 60 liters every hour that we're getting nutrients that supply the micronutrients, specifically the smaller nutrients that help to supply our brain with nutrients to help us focus and regulate and have attention. And so if we're not able to get those nutrients from our food, or there's a difficulty utilizing certain nutrition or nutrients from a genetic standpoint or from another a hormonal standpoint, or some other issue, then it's hard for our brain to get those nutrients and be able to focus. So what I'm hearing you say, Kim, is that even just the ability to be able to comprehend, sometimes we just don't have that because we're missing those nutrients that can help our brain do its job. And when we think about nutrients, and I'm talking about things that help to make our neurotransmitters, like you guys were talking about with the dopamine, right? That neurotransmitter, or serotonin, things that help these chemical messengers get to the brain to signal to do these certain things. Those come from our foods and our nutrients, like our proteins, like you were saying before. Proteins help to make those neurotransmitters to help us to be able to focus and regulate, etc. I don't know, Dr. Boles, if you can touch on that a little bit with the genetic piece too.
Well, yeah, I do want to talk about the genetic piece, but before we go, that's a huge, big topic, and it's very important, but I want to just cover some of the discussion areas that we were talking about first. In terms of, we kind of went over what we think, what ADHD is and everything, and then Dr. Griesbach mentioned that it's very severe. I mean, in the lecture that I gave a month ago on the Facebook Live, I went over all the different things, that everything from drug addiction to homelessness to divorce to having children early, school failure, all of these things. Car accidents are higher in people with ADHD, and so managing it correctly becomes extremely important. It's not just some minor disease or something, but something that you need to take really seriously. I also just wanted to, so on topic number 2 that we were going to talk about, the comorbidities. A lot of people will say, well, my kid has autism, or my kid has intellectual disability, or my kid has something else, learning disability. Can they have ADHD as well? Well, definitely. I mean, ADHD is, going to the genetic component, ADHD in most cases is caused by genetic abnormalities. They're abnormalities that were inherited from both parents. Sometimes they're new mutations which weren't in either parent. And a lot of times I see both of those. So it's very polygenic. There's multiple genes that are involved, and there's multiple variants in each gene that can predispose towards ADHD. And it is, with autism, it's the most genetic of all of the common disorders. So that being said, is that the genetics has a major biochemical component to it. And then that's often where the nutrition fits in there. But the genetic component also has to do with the comorbidities, that if there is something in the genetics that makes it more likely that nerve cells are not going to work right, depending on the rest of your genetics and the environment is what you'll get. You may get ADHD if the executive function is not working right. You may get autism if the social communication part's not working right. You may get anxiety, depression, panic disorders, etc., if some of the emotional components are not working right. And then if all of the parts are not working right, you can get intellectual disability. Certain parts are also involved in, to a lesser degree, the intellectual disability and learning disorders, which could be dyslexia or dyscalculia with having problems with math. So a lot of people with ADHD will have other problems: autism, depression, anxiety, occasionally even seizure disorders, migraine, learning disabilities, intellectual disabilities. But you can have just one of these. You can have just ADHD or just autism or just learning disabilities, or you can have any combination of them. So that's on the diagnostic side. But on the mechanism side, the parts of the cell, so the mutations in the genes lead to the behavior, but in between that is the whole mechanism. How does the mutation cause the disease? There are many things in that component, and most of those are treatable with nutrition. Mitochondrial dysfunction being the main one, but also membrane fluidity and neurotransmitter balances. And there's many, many more. I just picked those 3 because I think that they're key to that. So to bring it to Dr. Griesbach in regards to how you determine those things in your patients. You're more of a primary care provider than I am, seeing people in the community, where I see usually the tip of the iceberg more.
So can you clarify your question a little bit? I was a little confused.
Regarding how you in practice determine if people might have mitochondrial dysfunction or other issues such as neurotransmitter imbalances, membrane fluidity, or other pathophysiological mechanisms that might be related to why the patient has ADHD and or other issues. And then you can use that to segue to treatment.
Okay. Well, you know, when in terms of mitochondrial, I probably, you know, of that group of conditions you're talking about, I'm probably seeing more the ones with mild mitochondrial disorders who have low muscle tone, poor coordination, fatigue, and they have ADHD and maybe some other learning challenges. So in my developmental delay group is where I look for those mitochondrial disorders. For those patients especially, they need to be on not just a good nutritionally sound diet, but they need additional support with the supplements because you're the geneticist, but my understanding of how it all works is that we have these, each of us has these unique variants, and especially those who are exhibiting signs of metabolic and mitochondrial disorders, those variants prevent the individual from making the energy in the cells, which is so critical for global functioning, and so providing the additional nutrients and micronutrients can help those mitochondria function more optimally and help the cells function more optimally, so that there's more energy, the individual has more energy, and is more capable of functioning globally.
So I just had a question come up that kind of fits into this. So if it's genetic and this child or, you know, adult has had this since birth, what's the treatment? And from what I would understand, it depends what the variants are that come up through the genetic testing, correct, on how you would treat?
Yeah, there's two aspects of that. First of all is that in ADHD, there are certain mechanisms which come up in almost all of the patients, mitochondrial dysfunction being one that comes up possibly in all the patients, but certainly in the vast majority. In imbalance between the excitatory neurotransmitters that turn on the brain and the inhibitory neurotransmitters that turn off the brain. There's an imbalance there that's very frequent in that. And there's also issues in terms of membrane fluidity and other issues. So when I get a patient, I usually start them on certain dietary, well, first of all, you have to look at just the ABCs, the major thing: good, clean health, good diet with natural antioxidants and not taking a whole lot of processed foods, exercise, sleep, and avoidance of certain things like smoking or too much alcohol, drugs, etc. So once you've addressed the general health, then you can address that second line of issues is things that are almost always out of whack in somebody with ADHD, irregardless of what the individual genetics are. And so then I address neurotransmitters, mitochondria, and membranes. And then the third part is, okay, well...
Dr. Boles, could you, I think maybe some families might not understand membrane fluidity.
Oh, okay. Well, you know that there's some fats are oils and they are liquid, and some fats are substances that are solids, like butter. If butter will melt very quickly. The fluidity is it like a vegetable oil or is it like butter? And it needs to be just right, and that's, you get that by what fats are in the membrane. And there are the cell membrane, right. Well, it's also other membranes of the cell, but mostly the outside of the cell, but the membrane of the mitochondria, the membrane of other parts of the cell as well. And so you need to balance those fats. And in the brain, where there's a very large number of these membranes, and the fluidity is extremely important. Modern diets usually are deficient in omega-3s, and many diets are even deficient in omega-6s. And we can get that when we get to the dietary component, but those are the things to try to rebalance the fluidity of the membrane by adding those in there. So there's the two components, the general health and the ADHD health thing that are like the membrane fluidity, the neurotransmitters in the mitochondria. But beyond that, it's like, well, why does my child, what is different about him? What are the mutations in my child? And how can that help you to know what treatments might be specific to my child that won't help another child with the same problem? So in that case, I do DNA sequencing. I do whole DNA sequencing, WGS, whole genome sequencing, the whole 3 billion nucleotides, to find out what the sequence variants are in the individual that lead that person to ADHD. And more often than not, that information translates directly to the treatment that I give. I mean, there's sometimes I say, I can't find anything. Sometimes I say, I found it, I don't know what to do about it. But more than 50% of the time, I find something that is treatable, we treat it, and the patient gets better because of it. So, I mean, that's how far we are in genetics, where even 10 years ago, nobody knew what any of these patients had. At this point, over 80% of my patients have exact diagnoses.
And where would parents find, how would they go about getting DNA testing? Is there a website that they can go to, and does insurance pay for it?
Insurance does pay for it in the vast majority of situations. If a geneticist orders the test and codes it correctly, it almost always does. If you have a government insurance like a Medicaid, Medicaid almost always pays for it. It's state by state. I think it's about 45 states or so do it by now. Will they deny it? Of course they will. Well, and then we put in a bunch of, they put a denial in, and then we send letters, and eventually we get it through. Not all genetic testing is by any means equal. I do trio testing, both parents and the child, because it's frequently a new mutation that's not in the parents. Those are quite frequent, particularly in anyone with intellectual disability, but even in those without it, you can sometimes see it. And those with seizures or birth defects. Those are very, very frequently have a new mutation, but you can see it in any of the patients. How to get somebody to read your whole genome and to determine where to go from that. There's very, very few people that do that. I do that. There's some academic centers that do that, but unless they're really an expert on that disease that your child has, they really don't know how to read the genome for those problems. You're really just relying on what the laboratory shows. So if we can go to Dr. Griesbach about our discussion question number 3 was, when do you order genetic testing? And the geneticist says always, but if you go to a cardiologist, you're going to get an EKG. Let's go to the person who decides to send them or not.
All right. So, you said we weren't getting this information 10 years ago. We weren't getting this information a year and a half ago. Well, you might have.
That's true.
And so it's really only now, I sent some kids in the past for genetics, and when you were with a different company doing the mitochondrial genetics, I sent a number of patients, and I sent many patients to be evaluated, and many of them came up with some significant abnormalities. They were generally my more complex kids who may have had ADHD or may have had other developmental issues or had some other more complex picture, and I think that was very, very helpful. At this point, it's still pretty expensive if insurance doesn't cover. Right now, I'm just getting into doing the whole genome, and I think that my key patients would be the one, not my garden variety ADHD, not like my own kid who, father has it, clearly familial, and not more complex physical problems. But kids who have more complex physical problems, it's out of the ordinary for their families. Those are the kids that I want to be sending for the whole genome. And then I have others. For example, I have a patient whose brother is high functioning autism, and I'd like to get him done. But more critically is his sister, who has anxiety, but she's developed chronic fatigue this past year. And so I'm working on getting the family to do the whole genome and have you evaluate it. So ideally, and maybe in 5 years when costs come down and Dr. Boles can clone himself, and there can be many more people reading the whole genome, because it's not like a blood test where, okay, your cholesterol is definitely high. And even as a developmental pediatrician, I know what high cholesterol is. But, when you're looking at a whole genome, it requires a very sophisticated level of interpretation of the spelling errors that are going on in the genome. And you need someone who is as capable as Dr. Boles is reading it. Otherwise, you get some AI process that, picks out known things, but isn't really looking at the subtleties. So I think if your child has any level of complexity, autism, any physical manifestations of difficulty, in addition to any learning or ADHD problem, then I would start going for the genetic assessments.
That sounds really good. I mean, it's like if you have something else that's like significant, like epilepsy or autism, physical disabilities, I would add in birth defects or something like that, and then ADHD is part of that, there's probably a genetic abnormality that we can most likely find at this point. For people that just have ADHD alone, or with ADHD and that say dyslexia and nothing else, or ADHD and anxiety or something like that, I do make diagnoses on some of them, and some of them I don't. Maybe 50-50 hit miss right now.
Right. I think a lot of my anxious patients, there's probably some reason, the more significantly anxious patients, I think that population, I would love to be doing more genetics on them.
Yeah, they're very infrequently done. I mean, across the world, very few people have looked at whole genomics in them, and sometimes that can be helpful.
So let's jump back to the, what would you guys say the role of mitochondrial dysfunction is in ADHD and connecting it with stimulant medications? How do stimulant medications help those with mitochondrial dysfunction?
I mean, as a mitochondrial medicine specialist, most people with ADHD have mitochondrial dysfunction. That's in the literature, a whole bunch of papers on my website. It's in the NeuroNeeds website. It goes over all of the papers, so you can show to your doctor. See here, there's 12 scientific papers that show that, so that there's no evidence. Here's the evidence. But also, what's scary as a father of a child who's on this medication, is that the medication does cause mitochondrial dysfunction by itself. In many cases, particularly in those cases that are on the more severe side, the medication is absolutely necessary. I am not against medication, but I am very pro-nutrition in this. I think that the nutrition often helps a lot, and to some extent it can mitigate some of the harm of the medication. So I am to say nutrition is very important because there is mitochondrial dysfunction. Many, perhaps most of the patients will need medication, and then the mitochondrial directed therapies are also important to mitigate some mitochondrial side effects from the medication. So when I see somebody with ADHD, I refer them to a developmental person such as Dr. Griesbach, just as she refers them to me to read the DNA. So I refer this question to Dr. Griesbach is, who needs medication when, and how you deal with the mitochondrial aspects?
Well, if we're looking at ADHD, it really, when do we treat with medication? I'm getting a self-selected population. because these are kids who are probably already struggling. But there are kids that I have seen, or, you know, maybe the siblings, they have ADHD, but they're bright. They don't have any learning disabilities. They don't have any other behavioral manifestation. And with, you know, at the right school where they're not overwhelmed, they can do fine. We may not need medication at all, or we may need medication when they're older, like in middle school or high school, where the demands just ramp up, and having a little bit of ADHD just isn't going to cut it and allow them to be able to, you know, work optimally at their ability level. And so there are some patients, I have some patients who, when they were younger, and I was just talking to another pediatric psychiatrist, and there was a supplement called Erin a number of years ago that I gave and she gave to younger patients. And that was an omega with the phospholipids in it. And that was really very, very helpful for many of those younger kids, and tided them over because brain cells were now working better, and tided them over to a time where they, you know, later on could benefit from medication or not need it. Dr. Boles' new formulation of the omega needs, Erin went off the market for a variety of reasons a number of years ago. And now we have Dr. Boles' omega needs, which it functions very similarly in that it's providing the omegas, the omega-3s that the brain needs, but connected with the phospholipids, so it gets into the brain cells much more efficiently. And so, but if a child is, so I will use that along with anything that I'm, you know, treating for ADHD, if I'm using medications, but I will also use that for younger ones, so that we can allow the focus to be better and the behavior to be better. I lost my train of thought here.
I covered the question completely.
What I would say is that any child who is struggling in school or struggling socially or struggling behaviorally, they're not doing it, they're not choosing not to learn at school. They're not choosing to misbehave. They're not choosing to maybe avoid peers or to get in their peers' faces. And so those are the kids who definitely need to be medicated. If they have co-occurring learning disabilities, you know, if your focus is off, you're not going to be able to benefit from that educational therapy and the supports that you get at school. So in most cases that I see, kids do need to be treated pharmacologically. And again, you know, you can't just throw the medication at the child. You have to also support the sleep, the exercise, and the nutrition as well.
Yeah.
I have an interesting family. I've been seeing one of the brothers. There are 4 boys in this family, and I've been seeing one of the brothers for his ADHD. His behaviors were, and he's doing well. He's in high school and doing well. His behaviors irked the family. The youngest one I saw, and very bright, very social, but definitely very hyper and impulsive. But the family chose not to medicate this young man because his behaviors didn't bother them as well, and he managed okay in school because he was so bright. But now he's in middle school, and his behaviors are problematic. They would have been under control had he been on medication previously, and now they're having to pull out all the stops and try to regroup with this kid because he may get thrown out of school.
Yeah, we tried, you know, supplements and diet, and that was kind of getting my son by. Okay, he still had the issues with reading comprehension and things like that, but then when he got to middle school, he couldn't do it anymore. I think the social demands changed when they hit into middle school. You know, you're not a little kid anymore. Puberty, it just got a lot harder for him, and that was kind of
the volume of working.
Yeah, well, and then the switching classes and having multiple schedules. I remember one time he told me that he was sitting in class and he was, you know, trying to learn, and they had a fish tank in the back of the room that had like a bubbler on it. And he's like, I can't stop hearing it. Like, that was taking over his concentration, hearing this bubbler, which, you know, was pretty quiet, but it was like overwhelming everything in his head. He couldn't concentrate on what the teacher was saying. And, you know, I took him to his pediatrician, and he did get a proper diagnosis, and he got on medication and everything like that. And he just says it just calms things down, where he's not hyper focusing on the smallest things, like tons of stimuli coming into him at once. So he thanks me all the time about getting his medication. And but yeah, it was when middle school hit, that's when he just couldn't cope anymore with just supplements and diet and all that.
One of the things that I tell parents is that, and I tell the kids this, is that it's not going to, you know, it's like glasses for the brain. You know, I'm a great reader, but if I take my glasses off, I can't read anything, right? The medication allows your brain to focus. You can choose to use that focus for good or for evil. But you know, it isn't forcing you to study, but, you know, if you want to study, if you want to learn, if you want to pay attention to the teacher, then it will allow you to be able to do that.
Yeah, so, just touch on that for 1 second. I just want to touch on that for 1 second. So, yes, medications can definitely be beneficial. And in some kids, in some cases, a lot of cases in my situation where kids are coming over from psychiatrists, where the medications aren't working, they need some support from nutrients, or there are parents who don't want to go the medication route first. They want to try alternatives first. There are benefits to doing the supplementation, and some kids actually do respond really well without needing the medication. So I just wanted to throw that out there too, that it could go either way. Some kids can just benefit from supplementation and diet alone, and then some kids do need a little bit more medication, or there are kids who can taper off the medications and just use supplementation and diet alone. So just wanted to throw that out there as well.
Well,
I was going to ask Erin, what is your opinion on nutritional intervention with food versus supplements?
You cannot have either or, it has to be both. The amount of nutrients that we need, especially the micronutrients, the zinc, the folate, the B vitamins, all those cofactors, the enzymes that help the neurotransmitters work, our dopamine, our serotonin, those things that we were discussing before, are necessary and in larger amounts than what we're getting from our regular diet, right? Especially kids with ADHD, we just need a lot more support. And regardless if you eat 10 cups of kale or whatever throughout the day, you're just not going to get the same amount of nutrients that you need from one food. And when we talk about variety, a lot of these kids have lack of variety because of sensory disturbances like taste, texture, mouthfeel, etc. But also it's because they have low zinc levels or low magnesium levels, or they have difficulty using the proteins for fuel from a genetic standpoint. So as a result, their taste buds, their taste receptors aren't there. So they might be less likely to try new foods too. We also have to think about that perspective. Once in practice for me, once I start seeing that kids are getting those micronutrients in, I do use a lot of supplementation. I noticed that the kids are actually starting to be more receptive to try more foods and also to eat more because those nutrients are going up and those sensory systems are starting to work a little bit better. So the answer is they can't just have food alone. They need both supplementation and food to kind of to help them get the regulation that they need, help them with whatever's going on in terms of focus, inattention, hyperactivity, etc.
There are studies that have been done. Bonnie Kaplan and Julia Ruckledge have done studies. Yeah. And Dr. Boles, I think there was someone else that you had mentioned that I wasn't familiar with, but there's documentation that supplementation with micronutrients can in fact treat a variety of neuropsychiatric disorders, in some cases as well as medication.
Yeah, we do something called an OAT panel, an organic acid test, a lot in our practice. So to see what their neurotransmitters are doing, we look at that against some of the genetics. So some of the psychiatrists that are giving me their genetic profile, which I can't read, they do that. But then I look at the nutrients that help to assist those medications to work better. So like if it's a B6 or sometimes kids just need a little bit of methylfolate or B12 or zinc or magnesium to help those medications work better or just help those neural pathways function a little bit easier. That's something that we could look at in testing. So that organic acid test looks at what the neurotransmitters are doing, but it also looks at the nutrients. What's the mitochondria, the energy of the cells doing? How are we breaking down our carbohydrates, our proteins, and our fats for fuel? And are we able to digest and absorb what we're eating? I think that's another big issue is it's not just about what we're eating, right? You can eat an apple, but can you digest it, right? Can you break down that food and actually use it for fuel? So it's not just as simple as let's get in the kale, the broccoli, the proteins. Like, is your body using it? Do you have the digestibility to break down those foods? Is there something happening in the gut with lack of absorption, right? Do we have low iron levels where we can't absorb our B vitamins, which are really important for the brain, right? A lot of times if we're exercising, especially kids, right? They're more active than adults often, right? And those red blood cells, again, are turning over very quickly, super important for the brain. And those red blood cells need to be they carry a lot of nutrients for the nervous system to be able to think and regulate and have mood regulation. So going back to that answer, there's things that we can do to kind of look a little deeper and help look at it from all angles.
Yeah. So one of the things that's important is really to, in my perspective, when using supplements is, you want all those micronutrients. You want to support not just the B vitamins, but you want the whole panel of vitamins. Dr. Boles can probably talk about that, and the micronutrients, because they all work together. So sometimes just supplementing with the B12 or the methylfolate is not sufficient. If you're particularly low in those areas, you may give additional supplementation. But my core supplements are really the omegas with the phospholipids, and then a multivitamin with all the micronutrients as well. And so those are the two foundational types of supplements that I use. And then I have to not only recommend them, but figure out how to get them into the kids. Because a lot of these supplements are not necessarily kid friendly, or because the kids are picky and they don't like certain flavors and so on and so forth. So should I share my trick for getting kids to take?
I just want to mention coenzyme Q10 as well.
Oh, I'm sorry.
Yeah.
You're right.
And then go ahead.
That's a big one. And just an FYI, I'm also involved on the Alzheimer's end. I happen to have an APOE4 gene, which puts me at slightly higher risk. And so I've been investigating all of that. So, you know, your omegas, your vitamins with the micronutrients, and your CoQ10 are all real critical, along with some other antioxidants to further supplement, is also important for Alzheimer's. You know, all of the things that we're recommending for ADHD is true for good health, physical health throughout our lifespan. You know, the exercise, the sleep, the good diet, and the supplementation. Everybody should be doing this. But for kids to take pills, sometimes, you know, I have them open it up and mix it in something, but a lot of times that doesn't work. So I use, I have an ice cream strategy here for getting kids to swallow pills. And because if you use like applesauce or yogurt, it gushes on the spoon if you put the pill in it, and so the kids can feel it in their mouth. They choke it up and they won't try it again. So with the ice cream, it stays firm at least for a little bit. So you put a little bit of ice cream on a small spoon and you have the child swallow the ice cream. You have another spoonful of ice cream, plain ice cream, no nuts, no chocolate chips in it, and you have them swallow it. And then the third spoonful of ice cream, you put the pill in and you do the same thing. So they're sort of primed to just take that ice cream and swallow it, take the ice cream and swallow it, and then take the ice cream and swallow it, and they've got the pill in there. And then over a relatively short period of time, you're down to just 2 spoons in the morning, and then 1 spoon in the morning, and then they're swallowing the pills themselves. And kids are thrilled to be getting a little bit of ice cream in the morning. We're not giving them a bowl full. So
mine lived off of applesauce for like to mix the supplements in, like the first probably year or 2 that we were doing supplements. And then I think his doctor put him on diflucan at one point, which I couldn't crush up and put into applesauce, but it was such a tiny pill. He learned how to swallow that, I think, when he was like 4, maybe 5. And like once he swallowed that, he was like, I can swallow anything now. And it's like, he probably has a way better like ability to swallow supplements than I do. Like he could put 3 or 4 in his mouth, you know, take a swig of water and he gets them all down. Me, I'm like 1, like I can't do it as good as he does. But yeah, I think just eventually, you know, something small to start with, then they build that.
Well, then you have to have a medication that you can use that's small.
Yeah.
A lot of most of the medication, you know, like guanfacine, they can often, which is a medication for ADHD, and so that's one that kids is a good starter pill because it's so small.
Capsules are so much easier than like a caplet or a tablet. I still have issues swallowing.
Well, some of them you can open up and mix in, but
yes,
a lot of my
syringe.
A lot of my picky kids won't like the flavor of what you know of the medication mixed into something. So that's where I get to the ice cream swallow. My one patient I have does not like anything sweet. And she's a picky eater in general, and she so needs the nutritional supplements. I even got her, went to Hardy Nutritionals, which has an unflavored one that dissolves, and it changes the color of the water a little bit, so she won't take that.
Let's go to, I think there's one more question that we wanted to cover. First, it's Erin. If you can just go into ways in which you can get people to take supplements if they can't swallow at all. They're for the really little kids.
I can't swallow. I usually like to use a syringe, actually, like in a very, very small amount of water in a syringe. Or you can also use jello, actually. It actually goes really nicely down the throat. You can also use a popsicle. I actually mix collagen peptides a lot of times in there for kids. And that's a way, like a very mini popsicle, and they suck on it and it will just melt down. So those are a few suggestions that I have.
How do you, where do you put the supplements when you got the popsicle?
Yeah, I mix them in. I mix them in a little bit of fluid, and then I make a popsicle out of, for the freezer. So I just mix it in the collagen or a little bit of coconut water or aloe vera juice, like the smallest amount that you possibly can. You can use a fruit if you want to mix that in, like a whole fruit to get the fiber. I even throw like flax and stuff in there so that you get some fiber.
That's an interesting way to get the water-soluble ones, the ones that you can put in water. Yeah, the oils would be a different story.
The fish oils.
Yeah.
Yeah, those are harder when they're capsules for sure. Liquids sometimes are a little bit easier, but yeah, that's typically hard. Peanut butter sometimes. But for the kids that have difficulty swallowing, you kind of want to use something that's a little bit more, that just goes right down.
We did have one question that we haven't, that we said we were going to discuss, and it has to do with hypoglycemia. Why does my child have low blood sugar, lethargy after eating? How is that in common with ADHD? Because I know with my son, that was actually something that he was diagnosed with before he was diagnosed with ADHD, the low blood sugar. And we had thought that was it. We thought, oh, okay, this is why he's acting this way. This is why he's having these issues. But as time went on, we found out it was kind of connected. So where's the connection? Why do kids with ADHD also experience the low blood sugar?
So in my experience, most ADHD kids do not have low blood sugar unless they also have something like a mitochondrial problem. This is not, if they're picky eaters and they're crashing because they haven't eaten, that's a different story. But most of my more typical ADHD kids do not get hypoglycemic, but the ones who do get hypoglycemic have some other associated metabolic issue. So that needs to be addressed, and they're probably, interrelated. The two problems are interrelated, and a lot of times you will see the difficulty with the hypoglycemia or other manifestations of metabolic problems earlier than you will to be able to diagnose the ADHD.
Hypoglycemia, just so we know, is low blood sugar for parents who aren't sure what that means. But hypoglycemia from a dietary perspective is when you're consuming a simple carbohydrate, something that like sugar or soda or even fruit sometimes, right? And our blood sugar goes up, and then we're supposed to make a hormone called insulin that regulates our blood sugar. The problem that I see with ADHD is that we're getting this really quick spike of sugar to the brain, and then we make insulin, and if we don't have protein and protein and fats to help carry that sugar through the bloodstream and for the brain, then we have this drop, and then we have anxiety, irritability, etc. Right? So it's more of an issue of just more blood sugar stability in the brain versus, and it could be a mitochondrial issue for sure if somebody is just not eating enough for a very long time and their blood sugars are low, etc. But also just from a very basic blood sugar standpoint, making sure that we're getting all three macronutrients, your carbs, your proteins and fats, especially fiber, because that fiber from your vegetables or from flax or other things that kind of help us, protein also to kind of help us carry that sugar that we're eating through the blood to have that energy level. So
right, that isn't necessarily associated with ADHD. That can happen to any one of us, and that's one of the problems with the standard American diet that's so heavily oriented towards the quickly absorbed carbohydrates, the processed foods, and our blood sugar spikes and then it crashes. And then we're starving, and irritable.
And then if we think about sugar and dopamine, right? Sugar can increase that excitatory neurotransmitter to make us want to crave more sugar, right? Or make more dopamine because we're consuming a sugar, and then eventually our brain wants more of that. So it's like this feedback loop, right?
Well, but also your blood sugar is going down so low and your body is saying, I need
exactly
sugar.
Exactly.
I see we're getting to the end here, yeah. Dr. Boles.
I did this go over the questions. The questions from the audience?
Oh, okay. 1 second. Oh, let me go through here. Okay, for genetic testing, what about kids who are adopted and you cannot do DNA testing on the birth parents?
It's difficult. It depending on what we're looking at. Sometimes I mean, it's less likely I will make a diagnosis if we don't have the parents. But it doesn't mean that I can't make a diagnosis without the parents. It makes it more difficult.
Okay. Another question regarding oat testing, organic acid testing. This person asks, so the oat testing thing determines what of those foods are being processed, working on, or not. It doesn't so much
look at specific foods. No, it doesn't look at specific foods, but it looks at how we're using our amino acids, our proteins for fuel, our carbohydrates, and our fats from a mitochondrial standpoint, from the energy of the cells. Like, how are we using those nutrients? It also looks at the B vitamins, your vitamin C, your glutathione, your detox pathways. It looks at yeast, bacteria, mycotoxins, those kinds of things.
I have a parent who's asking for a recommendation for a doctor. Isn't there a list on the NeuroNeeds website of doctors?
Yes.
Yes. Okay. So if you go to the neuroneeds.com website, on the left-hand side in the menu, resources, you can look for a doctor, or you can send us a message and I'll try to help you with that, because I'm in California. So I know some of the doctors out here. Somebody says puberty affects executive functioning.
It makes it more difficult.
Hormones, correct?
There's many more voices that are screaming at you.
Well, I know my son, he's 15, and sometimes like I'll be like, he'll be in a mood or whatever, and I'll be like questioning to myself, okay, is this puberty? Is this ADHD? Is this just, him being a person and being in a bad mood today? It's like, it just adds, I think, another aspect to the whole thing. So.
I find that with puberty, my garden variety ADHD kids, are just like any other kid with their pubertal reactions to their parents. They may be getting more overwhelmed at school because the demands are increasing. But the population that really has problems are the population that has more significant behavioral difficulties early on. And during that time where the hormones maybe even starting to churn under the surface, you don't even see the mustache coming or any of the other physical changes. All of a sudden you could be cruising into age 11 stable, and then all of a sudden the behavioral problems worsen for a few years until we get through the biggest part of puberty development.
Also, I had heard that, I know without medication, a couple other ADHD doctors, I had listened to lectures and things saying that there is a maturity difference in those with ADHD. Like there's a year or two gap that sometimes happens with I don't even know if you'd say brain development, but like
in studies, that the cortical thickness of the brain, the brain cortex gets thicker and thicker and thicker every year, and until we finish maturation is in our mid to late 20s. And the last part to mature is, of course, that prefrontal cortex that we've been talking about today. And when they look at larger numbers of kids without ADHD and kids with ADHD, the ADHD population has a thinner cortex to begin with relative to their peers. Whether you're on medication or not, that cortex continues to thicken and mature over time, but throughout their childhood and development, their brain is like a less mature typical brain.
Yes.
Not just at puberty. But what happens at puberty is you're in middle school and high school, so the demands increase exponentially. So that difference may be much more dramatically observed.
Okay, another question was, this person is giving omega needs to their 4-year-old, and she is putting it in juice, and she wanted to know if that's a good way to give it to them, or does it reduce the efficiency?
It's fine. It's a little bit easier sometimes to mix it with an oil, because it is an oil and water doesn't mix very well. But you can mix it in like with a salad dressing or another medication or something that like CoQ that's an oil. But anything that you can put it in that she will take is fine. Just don't boil it.
Oh, okay, I have another parent who says, our genetic doctor says the whole genome sequencing doesn't render results for over a year, which makes it not useful. Is this accurate?
No.
I don't think so.
No, it takes about 4 months now.
Let's see. Our 17-year-old ASD daughter has mitochondrial dysfunction, diagnosed from an OAT test, and she had started doing riding a bicycle assisted recently, and and I guess her child's regressing. So she was wondering what could cause the regression.
There are a very large number of possibilities that would have to be. I mean, mitochondrial can cause regression, but it can be a problem with an ion channelopathy, or there's so many different possibilities. It does sound like something that needs to be evaluated immediately.
I think, let's see. That looks like it's it for questions I see right now.
That's a child, by the way, that would need to be evaluated with the whole genome sequencing, because, obviously it's a metabolic problem that was identified previously, but it may not be remediable by just the usual mitochondrial support. It may need to be something else.
Right, it needs a whole genome. And also, talk to your doctor about leucovorin folinic acid, because that a deficiency of folate in the brain can cause regression, and that's something that might be immediately reversible.
Okay, one more question, because this actually was on one of our lists to answer. I don't think we got to it. Gluten. So there's a lot of research about avoiding gluten with autism. Does that also apply for those with ADHD?
So I'd like to do testing before removing gluten. We have celiac disease, right, where the microvilli is completely flat, right? And that's completely separate than a food sensitivity, which when you're doing testing, it's hard because, we're not doing, if you don't see celiac in blood work, and you also you need an endoscopy really to diagnose celiac, but for gluten sensitivities, even if there is a gluten sensitivity, sometimes as a result of a lot of other inflammation, gluten will come up positive. But I usually it's very individualized. So I don't necessarily say take gluten out for everybody, but I do find it beneficial a lot of times with some kiddos, and I take it out and see how it goes, or you can do testing. And also there's a very specific peptide. It's called gluteomorphin or gluteomorphine. It acts like a peptide, an opioid peptide on the brain in some research. So that can cause some inflammation for the nervous system in some kids. But like I said, I don't recommend it for everybody. And I know you guys might have another opinion, but if you do find that you take gluten out and it's beneficial, regardless of testing, I know it's really hard to do for your kids, but I find something that's helpful with the kids that I see.
So I happen to be gluten sensitive myself and not celiac, and looking at it, other family members are as well. So I'm very sensitive to thinking about gluten, but my primary goal is really to get the kids off the junk food, off the little cheese crackers and the carby snacks that have no nutrients in them, and really to enrich the diet throughout the day. And if they're having any GI problems at all, I'll definitely recommend a trial of being off gluten for a while. It's often very, they're coming to see you, so they're expecting some nutrition recommendations. They're coming to me expecting other things, and they may not be ready to try that. Yeah. But in some cases it helps. But I think if there's no real GI issues, I haven't found a lot of benefit. But I have a few patients for whom, who are gluten sensitive, and it's really helpful. But it doesn't necessarily help their ADHD.
It's interesting. I just want to make one more point about that, because I actually have celiac disease, and I was diagnosed a few years ago, and I never had any GI disturbances whatsoever. Mine was all neurological, so anxiety, depression, etc. And I did testing, and everything was in red, right? And I had no idea, and I never had a GI symptom ever. And so when I did get the endoscopy, I had celiac. And so I just want to throw that out there, because you don't have to have gastrointestinal symptoms, especially if think about the sensory system. When you take Tylenol or Advil, right, you're not treating the problem, but you're blocking the sensory system to kind of tell you the perception of pain, right? So I wonder if sometimes that could happen in terms of the gastrointestinal tract too, with the sensory from the gut and the brain connection. But just so you know, sometimes some people don't have any gastrointestinal symptoms and they still have issues with those foods.
I think looking at celiac disease is way, physicians never think of it. I've diagnosed a couple of celiacs in my day that even the GI doctors didn't even think to do it. Yeah. So, it's an important one.
All right. Well, we've run over, and we could talk here all day, I think.
Apparently.
Sure. But I just wanted to let everybody know there will be this is recorded, and we will have it up on our Facebook page, and we will have it on our YouTube site later for if anybody wants to come back and re-listen or share it. We love when everybody shares. So thank you, Dr. Boles. Thank you, Dr. Griesbach. Thank you, Erin. And it was great talking with you all, and hopefully we can do it again soon.
Thank you.
Thank you.